I'm Amy Cueva, one of the founders at MadHow and Chief Experience Officer. I'll tell you a little bit about MadHow, some industry trends that we've noticed, and talk to you about the ability to understand medical billing design innovation challenge that we're working on with HHS. I am a designer and a self-proclaimed health insurance nerd. I love this stuff. I think that we have a huge opportunity to impact the lives of many, many people, and that drives the work we do at MadHow. Advancing slides. Yes, okay. So at MadPow, our purpose is to help improve health, help people achieve financial well-being, help them learn, and help them connect. And all of that overlaps for the conversation we're having here: health, financial wellness, and education. So our human-centered design process, what we focus on at MadPow, is to build empathy for the people we serve, all stakeholders involved, through qualitative research, ethnography, understand their real needs and wants, what will drive meaning and value in the context of their actual lives. Not what we assume that they might be, but as they actually are. And with the information we get out of research, we get the information and inspiration to then envision a better experience for them. And that's where we get into experience strategy and service design. And so we're envisioning that experience delivered through every touch point they may have throughout the experience or in terms of their interaction with an organization. So that's purpose to purpose, person to person, physical environment, digital, email, text, print, all of those things. We dive deep into behavior change, especially in health. We're looking at how to leverage technology, motivational psychology, game mechanics, behavioral economics, anything we can get our hands on to help people achieve the healthy behaviors that they want to achieve. And then we're looking at transformation. How do we help health organizations to form and grow their innovation practices? How do we apply the design process to designing the organization so that we're able to design and deliver improved experiences? And then we get into execution. So we build digital things as well. Because of our passion in health, we founded a conference 7 years ago dedicated to exploring the overlap of health and design. How can human-centered design help improve health experiences? That conference is once a year in Boston. Over 500 people attend. We dive into health literacy, behavior change. I host a health insurance track at the conference as well, where we talk about these very topics. We also this spring launched the Center for Health Experience Design. That's a MadPow initiative. The focus of the Center for Health Experience Design is to serve as a resource to the industry for human-centered design. We're doing training through the center, coaching, providing a pool of hours to support organizations who are maybe nascent in their journey of establishing solid innovation and design practices. The other purpose of the center is to help serve as a conduit for collaboration for organizations across the ecosystem who are serving the same patient populations, with the hypothesis of what could we accomplish together for the populations we serve if we work together in aligned forces. So right now we're forming projects in the areas of designing for mental health and addiction recovery, clinician burnout, designing for prevention and even chronic disease reversal. We're looking at envisioning health experiences of the future, creating a culture of health, and things like that. So some industry trends here. Many organizations are waking up to the value of design. Now, this is from a corporate perspective, but the Design Management Institute did a study. They scorecarded publicly traded organizations in terms of their commitment to design, and they found that those who had enacted a commitment to design outperformed those who did not by 228% on the stock market. So this isn't just fluff. It's actually good business and can be very meaningful on the nonprofit and government level as well. So we see a maturation that happens in terms of how an organization understands design, and it goes from hitting it with the pretty stick to understanding that we should create intuitive experiences that make sense to people, that they can flow through and accomplish what they want, to building a culture where the person is at the focus and empathy for them drives the decisions that the organization makes with regard to impact. One of the things we see in all of the organizations we work with is that the experience is a byproduct of how the organization is set up internally to deliver it. So if it's a mess of silos and there's zero collaboration, the experience is going to be affected. If there's policies that people don't know where they came from, they don't understand, that's going to affect it as well. And we see the same siloing happen across the health ecosystem. The patients left in the center of a very disconnected universe, left to find their way on their own. And so what we're trying to do is piece things together for them, working collaboratively across the ecosystem under the premise that shared values and shared action will equal shared profit, financial and social. Many of the organizations we work with in health, and we're working with pharma, insurance, health systems, nonprofit, government, health tech, they're waking up to this notion that what's good for the people we serve actually is good for the business. Increased satisfaction is going to lead to retention. The better they are, the more they're going to attract folks, the better their brand will be, and it will lead to long-term loyalty and satisfaction. And so many of the organizations we're working with are wanting to become a partner in health to the people they serve. And we're seeing this as health insurance companies try to move beyond being a partner in adjudication and a partner in health. And as pharma companies now, instead of just creating drugs, are looking at companion therapies and digital therapies to help people with their health. And so some of the things that we've worked on, decision support in maternity care, working with CVS to figure out how can we help people navigate through their health using the pharmacy as an important touch point. Working with the CDC on HIV medication adherence and how to help HIV patients track their adherence and move toward better adherence. Working with Cigna to build digital health coaches as artificial intelligence on every Samsung Galaxy device, over 500 million devices, to help people decide which healthy behaviors they want to work toward and get there. And then moving into insurance, welcometoaetna.com is a site that welcomes members that are coming from the exchanges and introduces them to some key health concepts, insurance, language, lingo, and some resources that people will need to understand their insurance with videos. I agree with all the videos can be helpful there. Also working with community health plans to look at things like member billing. How do we reduce frustration? How do we help people along their path? What is the problem? Is it a call center interaction? Is it a policy? Is it a process? So when we aggregate the thousands of interviews we've conducted with patients, consumers, and health insurance members, these are some of the themes we find, and it's kind of stating the obvious, but give me access to the best options to keep me healthy, save me money without sacrificing quality, make things easy to understand, answer my questions easily, be easy to do business with. And this is what health insurance companies struggle with, is that people are used to doing business with Amazon or whatever company that has invested a lot in design, in being good from a consumer perspective, and that's what people expect when they come to these experiences and interactions. And if there's something I should know, tell me proactively. I don't know what I don't know. Don't wait for me to figure it out. And then keep up with my expectations for experience excellence. So this is just baseline. Of course, there's much more. But this leads me to what I really want to tell you about, which is the design challenge that we're working on with HHS. So Secretary Burwell wants to improve patient experiences that are being delivered. There's a lot of room for improvement. Wanted to look at patient engagement, and one of the primary frustration points for patients is the state of medical bills. They're receiving, for one episode of care, multiple bills from the physician group, from the ambulance, from the ER, and they don't know why they're receiving multiple bills. They don't know if their insurance company has paid a claim yet. They might get bills that maybe they made a payment and they don't know if that payment is reflected. They might have multiple family members. And then they're getting the EOBs, which also need some work. And they're trying to piece they're trying to piece it together and figure out, what does this mean? And if somebody is dealing with a chronic condition or serious episode, this can increase their anxiety, which can have detrimental health effects, as we know. Also, if they don't understand their health insurance plan, and if they don't go and look at costs beforehand, either because they didn't think of it or it's an urgent care situation, it's likely that they're going to receive bills for more money than they expected. So we talk about deductibles. Deductibles are fantasy until you get the bill in the mail. And that's when they become real. And that's when some people will avoid getting care along their treatment pathway in the future if they can't deal with the bills they have right now, which is a big problem. So we partnered with HHS to create this challenge. It's sponsored by AARP, and I'll tell you a little bit more about it. So the challenge was launched at Datapalooza on May 9th, and it's open right now. The challenge closes on August 10th, so it's coming up. Then we're going to go through judging and then announce winners at the Health 2.0 conference in the fall. And basically what we want people to do is adopt a human-centered design process to create a solution for the challenge and apply, and then only there are 2 prizes, so there will be only 2 winners, but we might do honorable mentions as well. And as of right now, we've received over 400 applications for pre-applications, they're called. So over 400 teams across the country have indicated an interest in participating in the challenge. So we're going to get a lot of participation, and we can't wait to see the results. We understand that there are many factors that contribute to this problem. One is the bill itself. There are federal guidelines for what should be on a credit card bill. There are not those guidelines for what should be on a medical bill. The bill is a problem. There's jargon. There's information that's missing or that people don't understand. The way it's designed doesn't make sense. Again, is it the first bill, the second bill, the third bill? Have you contacted the health insurance company? So the bill itself is an issue. But perhaps an even greater issue is if people don't understand their insurance and they're getting bills that they didn't expect for higher amounts than they thought. And so that's what we're calling the entire medical billing experience, and it starts with plan selection. It moves into estimating the cost of care, and even the point of care experience. I don't know if any of you have been at a hospital or a doctor's office and said, how much is this going to cost me? And they look at you like you're from another planet. So that's part of the issue as well. So there's 2 prizes. One is redesign medical bill, and the other is, and this is more of an incremental innovation approach, and then the other is more of a disruptive innovation approach to transforming the medical billing process. And what I mean by that is, for example, and I'm not saying that I am a proponent of this solution, a consumer could say they need an MRI, they go to the hospital website or the health insurance company's website, they shop, they're like, I want this one with dye, please, this is the price, I prepay, and I take my ticket to the hospital and I've already paid and it happens. Again, there are many complications that can occur, and for risk-averse health organizations to even look at a model like that would be interesting. But in that model, there may be no bill at all. And so it's more of a transformational approach. Again, I'm not saying that's the answer. I'm just saying that's an example of how we could transform and maybe perhaps align better with what consumers experience in other realms. So we're looking at, from a criteria perspective, how is information and data being used? Are they addressing the top concerns that we've noted? Is the bill useful? Is it understandable? And did you use a human-centered design process, plain language, and uniqueness and creativity of the solution? When I say, did you use a human-centered design process, I mean, did you involve the people who will be affected by this solution in the creation of the solution? Did you go outside of yourself and the people you know to understand what people really need? One thing that was important to us and to HHS going into it was to make sure the patient voice was represented. And so what we did is a survey and qualitative interviews with patients to create a research report around what are the top problems and how do people feel about things, so we could give challenge participants good information moving into the challenge. They could be most effective. Moving into the transformational approach, we're going to look at, okay, are the issues addressed, and is this looking at future forward innovation as well? One of the other wonderful things about this, we did not want it to be a coloring contest. Look at you, good job, it's a nicely designed bill. We wanted this to actually hit the market. We wanted these improved experiences and bills to hit the market. And so HHS did a wonderful job at lining up these pilot partners seen here who have agreed to take the outcomes of the challenge and implement them in whole or in part. And so they're going to take it, and in fact, I think one of these systems just launched an initiative to redesign their medical bills. So this challenge has already been successful in stimulating innovation in this area. Part of the research report, which can be found at abillyoucanunderstand.com, we interviewed, as I said, patients, but also insurance companies and healthcare systems to have their perspectives represented. Some verbatims from research. System's too complicated for me to change. Our system is completely insane, and I hope it collapses soon. So a new, more sensible system might arise from the ashes. No one could tell me what the procedure would cost. Zero transparency. 52% of respondents didn't do anything prior to their visit to research cost. And 61% of respondents rated their medical bills as confusing or very confusing. 46% said their actions didn't clear up their frustration with their bill. 56% said they're hesitant about seeking additional medical care. So I told the provider and the insurer about the error. It took 2 months to resolve. I should charge for my time. I finally gave up and paid the bills, having no idea what they were for. And patients don't want separate bills from hospitals, nursing, doctors. We want one statement that shows everything we owe for that service. Again, in the transformational approach, maybe there's no EOB and no bill. Maybe it's one unified financial statement as well. So finally, top concerns: too much communication, hard to understand. Patients don't know what they don't know. They're feeling around in the dark. They may have questions. Are they the right questions? Am I missing something? Am I paying a bill I shouldn't pay? Are there more bills coming? I don't know. Terminology, the timing of everything, planning out their finances. If this is one bill of many, am I preparing myself financially? And then finally, trust, which we know is a big issue. So part of the participant packet was this research report, but also a diagram of the ecosystem. We want to identify all the pieces and parts that make up the ecosystem of the medical billing experience, from clinical to insurance company to third party to pharmacy. We also mapped an example patient journey to show how they flow through this ecosystem and what can happen as an example. We also showed bills and benefit statements so people could get a sense for what things look like now, and provided guidelines, some of which came from this group here. So resources on human-centered design, on health literacy, a checklist, things like that. So we can't wait to see the outcomes of this challenge, and maybe I'll come next year and present what happened. Thank you so much.